I was quite surprised by my findings, I'll be completely honest, and it has completely changed my opinion of Dilapan.
So a year later, finally in December 2021, we were able to offer it to all patients unless contraindicated. And 4 years on, we are still using in our unit as our sole method of mechanical induction of labour. And then in terms of counselling about the mechanical side of it, they should experience minimal hyperstimulation. Obviously, hyperstimulation could potentially lead to fetal distress and a potential emergency section before they've even got into established labour. There shouldn't be any of those so-called horrible prostate pains. Certainly in our case, there should be fewer examinations because once the Dilapan's in, we don't examine you again for another 12 hours, compared to in our case where we use prostate gel, so they're being examined every 6 hours.
I was quite surprised by my findings, I'll be completely honest, and it has completely changed my opinion of Dilapan. So here are some of the major findings. So greater changes were seen to the Bishop score from the first examination, Bishop score to the second examination in the Dilapan group. So therefore those in the Dilapan cohort required less subsequent cervical ripening interventions. Even more significantly, 40 of the women in the Dilapan group experienced rupture of membranes as opposed to only 36 in the prostate group. And interestingly, more women in the Dilapan cohort did require IV oxytocin, yet more women in the prostate group experienced uterine hyperstimulation. What also was particularly interesting was the finding that a higher vaginal birth rate was achieved in the Dilapan group, and given the higher percentage of vaginal births that were achieved with the Dilapan group, and the additional finding of minimal uterine hyperstimulation, which is similarly observed in other research by Gupta et al., it could be argued that Dilapan was overall the safer and more effective induction of labour method. What was the most significant finding in relation to the objectives of the service evaluation was around length of hospital stay, as Dilapan reduced the length of hospital stay by up to 12 hours 16 minutes, especially when used in an outpatient setting. And what's even more interesting is that in this service evaluation, length of hospital stay was significantly reduced in both the inpatient and outpatient Dilapan cohorts. So in conclusion, the study provided convincing evidence that mechanical induction of labour using Dilapan is a safe and effective alternative option. Furthermore, when used in an outpatient setting, it's not only safe and effective, but it supports patient choice and considerably reduces length of hospital stay, which could significantly impact on patient experience and cost efficiency savings.